first influence on the babe is the mother's influence, and this occurs well before birth. The babe is adjusting to the mother as its primary environment, the umbilical cord to survival before birth, but likewise a bond that ensures the babe of survival after birth as well. The babe becomes a politician if the environment is not warm and loving in order to survive, learning when to be politically correct and do the mother's bidding to avoid the mother's anger and potential abandonment. In households where the mother is control conscious, into control battle with others, and considers the child just another thing to be controlled, the child has two paths it can follow. It can cooperate, as it must for any kind of peace, or it can rebel. In some cases, cooperation equates to complete capitulation, with the eventual adult following religious edicts without question, adhering to the dictates of a corporate head or politician just as unquestioningly. They become distressed if required to question anything, as this raises the spectre of the mother's abandonment. In others, rebellion sets in early. The child is eventually either ejected from the household or virtually so, by a mother who ignores and neglects the child as much as the society she must live within allows. The child leaves home and never returns. More often than not, there is a seething battle, and this, unfortunately, is the root cause of anorexia. Mother represents food, and whether feeding the child from the breast or from the bottle, she will either make these early sessions a delight of touch and caring or a battle over the outcome. A control-oriented mother will not allow the child to choose the time and outcome of a nursing session, but will start dictating these issues. Normally, nursing occurs when the babe is restless and hungry, the mother's milk responding, and the outcome is a satiated babe falling back into sleep. A happy outcome all around. The child dictates the time and amount to be consumed. However, a control-oriented mother will try to decide when a nursing session or a bottle feeding session should occur. Her schedule, her determination on the amount to be consumed, and the battle over food started early. The babe tries to turn away as the nipple forced into its mouth again and again. The sense of anger in the air, and the framework of the battle has been laid. Close examination of the dynamics around the dinner table when the babe is a child invariably shows arguments about what food to eat, how much to consume, with the mother dishing it out onto the child's plate and watching closely that it gets consumed. This should be compared to the family where the child chooses what to load onto its plate from serving dishes, with only an occasional suggestion from mother to try the broccoli or whatever, with father commenting that if one fills the plate up, it is wasteful unless eaten a clean plate. Basically, the child chooses. Having had the issue of control over one's life, hopelessly confused with food consumption, the anorexic finds food fights clicking in, even when not the issue. If someone suggests they vote for a candidate the anorexic would not themselves choose, they stop eating. If the work hours are changed and the new routine not what the anorexic would prefer, they stop eating. If the spouse wants sex or does not want sex, averse to what the anorexic wants, for the evening they stop eating. In a world where tensions are on the increase, and those wanting control over their environment becoming more adamant and shrill, these matters will only exacerbate. Thus the increase in anorexia, which is likely only to become worse both in those who suffer and in an increase of new cases.